Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Mouth to anus. How do we determine where the gastrointestinal problems lie? So let's get right into it. First of all, when we have a patient that comes in our door, we're looking to see if they can smell and taste. So it's important to evaluate that, right? Oftentimes it's a neglected aspect of a physical exam when you have a gastrointestinal issue. Saliva production. When you open the mouth and you look in their mouth, the tongue should be clear, red, pink, and wet with saliva. Are they able to chew? Do they have issues with muscles of mastication, or do they have issues with the temporal mandibular joint where they can't chew properly? Swallowing. These are the individuals that come in and they have difficulty swallowing because of vagal nerve issues, or they just keep chewing and chewing and chewing and never really swallow. This is the slow eater. HCl production can be influenced by metabolic conditions. It can be influenced by infection. Pancreatic enzyme release is also another one. So that can be also neurodegenerative and metabolic. Gallbladder release of bile. This is one that can be issues with gallbladder sludge or insufficient contraction. Sometimes autoimmune disease can create this. Duodenal microvilli, or blunting of the microvilli, can be related to an autoimmune disease or food reactions. Intestinal permeability, or quote-unquote leaky gut, can be related to food also, and some antibiotic use and so forth. Ileocecal valve. This is a valve where the prevention of fecal matter or bacteria from the large intestine to the small intestine is prevented by the ileocecal valve. Oral tolerance is, these are the individuals that come in and they can only eat maybe 10 different types of foods. Anything else they eat, they have a reaction to. It's because of a restrictive diet they've been following for long periods of time. And over time, they eliminate foods rather than add foods back in. And they lose oral tolerance. Also, you have what we call microbiome diversity issues. And then you're going to have colon reabsorption issues of water, and then excretion of fecal matter. So we like to look at it from north to south, mouth to anus. In this case, really brain to anus. Okay? So let's look at the mechanism again. Smell and taste is neurological. Saliva production can be neurological, or sometimes medication will prevent saliva production. Chewing can be neurological because muscles of mastication can be affected, and TMJ, or temporal mandibular joint dysfunction. Swallowing can be neurological, especially with the vagus nerve. HCl production can be really metabolic, medications, food, infection, even neurologic. HCl production, let me give you an example. If you have an H. pylori infection of the gut, it will reduce your stomach acid. If you take more HCl, it might be beneficial in the short run to help, but it's not going to get rid of the infection. So the underlying mechanism is an infection, so you need to get rid of the infection. Pancreatic enzyme release can be neurologic or metabolic, or gallbladder release of bile is also metabolic or autoimmune. Duodenal microvilli blunting, celiac disease, gluten sensitivity, inflammatory foods, autoimmunity, which is really celiac. Intestinal permeability can be related to overuse of antibiotics, inflammatory foods. Infection can also do that. Ileocecal valve can be neurologic. Oftentimes when people have a concussion, they can develop SIBO, or small intestinal bacterial overgrowth. So the signaling from the brain to these areas can be impacted. So neurologically it can be impacted, and SIBO. Oral tolerance can be related to neurological issues, SIBO, and food, or immunological issues. So diet, diversity, and medication will impact gut microbiome, okay? And then you have issues with constipation, diarrhea. This can also be related to food and metabolic conditions. Constipation can be actually a neurodegenerative process that can be occurring. So when we look at this and we summarize, is it neurological when a patient comes in? Is it infection that's causing the problem? Is it a metabolic issue like diabetes or metabolic syndrome? Is it an immune dysregulation where you don't have enough white blood cells to mount an attack against an infection? Is it an autoimmunity? If this is an immune dysregulation of your own system, which recognizes your self-tissue or your own tissues as a foreign invader and your body attacks it. And that's autoimmunity, all right? So let's get into some cases. So before I get into this case, if you find value in these videos, I'm really excited to announce that we will be releasing a real comprehensive foundational modules on the topics that you are interested in. I'm going to link the waitlist sign up below in the description. Go ahead and sign up and you'll receive a complimentary document about magnesium. However, this foundational module will fill in the gaps that are missing for a lot of you people who watch these videos. It'll fill in these little gaps where you have misunderstanding or confusion about what to do. So it's a very important foundational module that we will be presenting very, very soon. Okay, so get on the wait list. So, case study. If a patient comes in and they go, I can't smell very well. I don't know. If my wife is cooking and I don't know what she's cooking. I can smell it, but I don't know what it is. They have issues swallowing. When you look in their mouth, the soft palate, when you go doesn't really move on repeat testing. So maybe you do it 2 or 3 times, it's fine, but 4, 5, 6 times they go and the palate doesn't move. That can be an issue with the vagal nervous system. HCl release, okay? And then you have a pancreatic issue, pancreatic enzymes that are low, lipase, amylase. Intestinal permeability can occur, right? Leaky gut, or ileocecal valve issues, or you have constipation that's occurring. So when a patient comes in like this, we have to ask, what might be the possibility, right? Think about it. I said it could be metabolic, neurologic, immunologic, autoimmunity, right? What would this patient be? Think about it for a second. I like to think this patient is probably neuro or neurological patient, where they have issues with smell, swallowing, and digestive issues. They might be early Parkinson's, degenerative Alzheimer's, dementia type patient. So this could be a neurological patient. Sure, other factors might play into it, but this is probably where we're going to start. We have another patient that comes in. They have gallbladder release issues, okay? Release of bile, duodenal microvilli absorption issues, okay? And then gut microbiome issues, right? When we look at a patient like this, this could be probably metabolic, or it can be maybe autoimmune. So in the initial consultation, we need to figure out where the problem might lie and then do testing specific to what we think is the clinical diagnosis. So we don't want to just go, oh, this patient came in, they have this problem. Let's give them HCl, pancreatic enzymes, let's give them leaky gut supplements and this fancy gut soil-based probiotic. Let's give them all this stuff and see if this will get him better. That's not the way to approach this. You want to be very specific. You want to have what we call the clinical decision-making tree. You go down from mouth to anus and figure out where the problem might lie, all right? And you look into all the different factors and then address it more specifically so that patient can get better and get to the underlying mechanism. Today we're going to talk about constipation and stimulating that one nerve that can eliminate constipation forever. So let's get right into it. Constipation, stimulating that one nerve, and that one nerve is called the vagus nerve. Vagus nerve is a cranial nerve, and there's 12 of them, and the vagus is number 10. 10th cranial nerve is one of the longest and innervates the entire digestive tract, the heart, the lungs, all the abdominal viscera, muscles of the pharynx, soft palate, larynx, which is responsible for what? Speaking and swallowing, okay? Now, it's important to understand when you have the brain, the entire brain, frontal lobe, temporal lobe, occipital lobe, right? All the parts of the brain will fire 90% of the output through the brainstem where cranial nerve 10 lives. So it can inhibit or stimulate the vagus nerve in the brainstem by having proper brain function. So one of the clinical signs is if you have a bad brain or neurodegeneration, it could impact the vagus nerve, okay? Now, what does it do? The vagus impacts balance of the sympathetic and parasympathetic. The vagus is parasympathetic. It's the rest and digestion nerve. Clinical signs: lack of fatiguing when you do a gag reflex. So when a patient comes in, we'll have them go, ah, ah, ah. We'll put a tongue depressor right in the back of the throat, stimulating a gag reflex, right? If the patient has a lack of that gag reflex or fatiguing of the gag reflex, you might get the gag reflex once or twice, but the third one, it doesn't exist. So the diminishing fatigability of the gag reflex is a clinical sign and symptom. Difficulty swallowing, right? I said pharynx, soft palate, and larynx. It's part of swallowing. If you have difficulty swallowing, it can be a clinical sign. Gastroparesis, inability to digest your foods at a normal rate or normal transit rate. GI problems, constipation, big one. Anxiety, because it's parasympathetic and sympathetic. If you don't have parasympathetic function or proper parasympathetic function, you're going to have anxiety. You're always in that fight or flight mode. Uvula. So when you open your mouth, there's this little thing hanging down right in the middle of your throat. Okay, that is called the uvula. And it will deviate away from the damaged side. So if you see the uvula and it shifts to my left, it's shifting away from the damaged side, right? The weak vagus nerve. Okay. Also, if you have Parkinson's disease, Lewy body dementia, or neurodegeneration, it can also impact the vagus nerve, like we said over here. Okay? Now, how do we stimulate it? How do we correct this problem? There are 4 methods that you can utilize at home in order to stimulate the vagus nerve. Number 1 is gargle vigorously. So you can't just go and go, oh, and then just spit out the water. What you need to do is you get a tall glass of water and you take a big gulp and you gargle vigorously. You might want to do it over a sink, in the shower, whatever. But it has to be vigorous. It can't just be just this little, It has to be very strong. And to the point, maybe your eyes might tear a little bit. That's how strongly you want to be able to do that. You want to sing out loud, like that crazy person in the car. You want to sing in the car, singing as loud as you can in the car, and people look over and go, who's that crazy person next to me, right? That's how you want to sing. Gagging, brushing your teeth and hitting the back of the tongue to elicit a gag reflex. You want to gag a few times to the point where your eyes tear, okay? So gagging is very important. Eyes must tear up. That's how you know you stimulate the vagus nerve. Okay? Number 4, coffee enemas. Coffee enemas will distend the intestine, stimulating the vagus nerve. And also will stimulate what we call the cholinergic receptors, right? And that will increase the bowel function or bowel movement. So when you do coffee enemas, what you want to do is get organic coffee. You want to steep it and then cool it down, obviously to room temperature. And then you have to get one of these little kits for enemas. And you want to lie on your right side and do the enema in the bathtub. You want to hold the enema as long as you can. So some people, the first time, it can only be 1 or 2 minutes. Sometimes you can hold it for 10 minutes. So you hold it as long as you can until you get that urge that you have to go. That's when you want to get up and get on the toilet. All right. So you want to start in the bathtub because people make mistakes. So coffee enema is a great way to stimulate the vagus nerve. So those are the 4 things you can do. Now, obviously, there are other things you can do to stimulate the vagus nerve. One is deep belly breathing. Take a breath in, let's say 3 seconds in. But instead of using your diaphragm where you're breathing like this, what you want to do is push your belly out. So when you breathe deep, push your belly out and then let it out slowly. So you can do it a couple of different ways. What we call box breathing, where it takes 3 seconds to breathe in, hold for 3 seconds, and then breathe out for 3 seconds. And you repeat that cycle for, let's say, a minute or 2, multiple times throughout the day. Another way you can do it is you take a deep breath, belly breathing again. Let's say it takes 3 to 4 seconds to breathe in. You slow down your breath and breathe out for 6 to 8 seconds. So if you breathe in 3, breathe out 6. If you breathe in 4, breathe out 8 seconds. That's how you want to stimulate that. Another easy one you can do is use a hot pack over your abdomen. Okay? That'll help stimulate it. You can also do massage of the abdomen and the neck. You can do kind of the base of the neck and behind the ears to stimulate that nerve. Another great way to do it is chiropractic care. Someone who's very skilled at upper cervical adjustments or hitting the atlas and occiput area. Chiropractic care can be very effective in that. There are some things called transcranial stimulation where you can put things on your ear and do stimulation, but that's a little bit more complicated. In the clinical setting, there'll be doctors who will use a neurostimulator. You can put it on your tongue, and that will stimulate back and into the vagus nerve. So that's another way to stimulate the vagus nerve. At the end of the day, you want to be able to be more parasympathetic. You want to be able to rest, relax, so you can have your normal digestion, bowel movements, etc. It's a great way to see if it will help with constipation. Obviously, if you have other issues like food sensitivities and GI inflammation, you need to handle those conditions. But this is one easy way to do this at home and see if it can impact constipation forever. Today we're going to talk about prunes and constipation. So let's get right into it. Some causes for constipation: lack of fiber, dehydration, lack of physical exercise, medications, especially pain medications, narcotics, antacids, blood pressure medications, including calcium channel blockers, as well as diuretics, diet. For example, high consumption of dairy can also cause constipation. SIBO, the methane version, can create constipation. SIBO is small intestinal bacterial overgrowth and is the #1 cause for irritable bowel syndrome. Hypothyroid. Underfunctioning thyroid will slow the system down and cause constipation. The #1 cause for hypothyroid is Hashimoto's thyroiditis, which is an autoimmune disease. Also, habits. Ignoring the urge to go to the bathroom. Oftentimes we have young ladies who don't want to go to the bathroom outside of their home, and that causes constipation over time. Okay? So these are some basic causes. Obviously there are others, but let's get into some of the benefits of prune. So prune has high sorbitol content, which is a carbohydrate, and it will loosen up the stool for better bowel movements, okay? It also is high in iron and can help with iron deficiency anemia. High in potassium, can also decrease blood pressure, and it's a great mineral. It has both soluble and insoluble fiber. It has something called phenylytic compounds, which prevents chronic disease like cardiovascular disease, as well as inhibiting free radical damage or oxidative stress to our body. It also has boron, helps with osteoporosis, okay? Adds bulk and decreases transit time. So it increases the bulk of the bowel movement as well as speeding up the process of a bowel movement. Insoluble fiber. So a great benefit of insoluble fiber is this. It provides food for the friendly bacteria in our gut, okay? And in the process, it produces other foods, things like butyric acid, propanoic acid, and acetic acid. So there are supplements out there that has butyrate, propionate, and acetate, which will provide food for our friendly bacteria. So it helps the ecology of our gut, not just increase transit time, but it actually helps improve the gut microbiome to a certain extent. Okay, so if you haven't tried prunes for constipation, it might be worth a try. Dosages: 4 to 6 ounces daily of the juice if you like. I prefer to have the actual prunes if you're going to help improve bowel movements. 1 serving is considered about 6 prunes. So you can ramp up to 6. You don't have to go to 6. So try 2, see if it helps. Okay, if not, go to 3. So no more than 6 prunes per day. Okay, so you can try that and see if that helps with your bowel movements and constipation. The fruit that fights constipation. What is it? How does it work? And what are some of the other benefits of eating this fruit? So let's get right into the video. Dragon fruit, other known as pitaya or pitahaya or strawberry pear. In 1 cup of dragon fruit, you have about 103 calories, protein of 0.6 grams, fat of 0.2 grams, fiber of 5.6. Remember that number, fiber of 5.6. Iron, 0.324 milligram, magnesium of 12.6 milligrams, and vitamin C of 7.7 milligrams, and even vitamin E. The other benefits are that it has a lot of antioxidants, and the fiber that's in it is actually soluble, and it has prebiotics in there. So there are other phytonutrients in here, so we'll list those in the description below. But it helps boost the immune function, improves cardiovascular health, helps digestion by having what we call oligosaccharides, which is a prebiotic, which promotes healthy bacteria such as bifidobacteria and lactobacillus. Improves insulin resistance, blood sugar reduction by up to 19% in diabetics when they have 1 dragon fruit per day. Helps to fight cancer, reduces inflammation, and it's great for your skin. So this is a lot of information here. What I'll do is I'll step away. I know there are a lot of people who ask me to just kind of step away so they can look at the board. So there you go. You want to go ahead and probably pause it and look at it. But this will be in the description below the video, so you don't really have to worry too much about it. So let's get into how dragon fruit helps with constipation. Now, yellow dragon fruit tends to be the best for constipation. There's about 5 grams of soluble fiber in 6-ounce servings. Basically, soluble fiber dissolves in the water and softens the stool and helps bind things like cholesterol. So it actually reduces cholesterol levels. Okay? And there's also oligosaccharides, like I said, which is a prebiotic, which is going to help feed the beneficial or healthy bacteria in our gut. So it has multifold effects when you start to impact the gut with the prebiotics. Improves your immune system, how your gut brain axis talks to each other. So there are many benefits of that. Now, yellow dragon fruit is not the only fruit that helps with constipation. There are things like pears, apples, citrus fruits, and kiwis that also help. However, clinically speaking, when I see it in my patient population, we find that dragon fruit, or the yellow dragon fruit, tends to have the most profound effect on constipation. And I'm not sure exactly what the mechanism is. It's likely the other components of the makeup of the fruit itself. It's also low glycemic index, which is great for, like I said, diabetics, but it helps with all the fiber binding and reducing the uptake of sugar. Now, if you want to use it for constipation, what I suggest is you eat 2 yellow dragon fruits per day until you get your first bowel movements. So what I see is oftentimes women will come in and they say they have maybe 2 bowel movements a week or even just once a week, and they need some sort of laxative in order to go. So for those patients, I would say take 2 dragon fruits or eat 2 dragon fruits per day until you get your first bowel movement. Once that happens, reduce it down to 1 dragon fruit per day. Again, there are different varieties of dragon fruit. There's yellow one, and there's a real red one. There's a Mexican one, which has spiny needles on it, and it's round. And those are very fragile and it's very expensive. But you can get the yellow dragon fruit in many stores, or even farmers markets might bring them in to their facility. I've seen that in places like Costco and even Sam's Club. So you can possibly go there and purchase the dragon fruit. Now, I will also link the studies below. If you're not a subscriber, go ahead and please subscribe. It would help our algorithm and it'll help our channel grow and maybe provide you with better quality videos in the future. All right? Today we're going to talk about SIBO, or small intestinal bowel overgrowth. What are the clinical pearls for SIBO, right? Small intestinal bowel overgrowth. So what is SIBO, right? Basically, you have bacteria that's abundant in the large intestine that sneak into the small intestine and overgrows, right? That's basic definition of SIBO. Sometimes it can be an issue of a ileocecal valve, the valve that keeps things from flowing backwards from the large intestine to the small intestine and creating overgrowth. So there can be dysfunction of the ileocecal valve. When we look at SIBO, the basic medical treatment is something called rifaximin, right? It's an antibiotic that can be used, and you have to go through between 2 and 3 weeks of antibiotic care, right? The cost for that is about $1,500. That's what the insurance companies will be billed. And if you have a deductible, or sometimes they won't cover this type of antibiotic, you're stuck with a $1,500 bill, right? So in the traditional medical model, they'll give you rifaximin, but they give you no dietary recommendation, right? This is problematic because SIBO is recurring, right? So you can knock down the overgrowth. However, if you don't change your lifestyle and dietary habits, it can come back. Then you're in for a second round of rifaximin. It's problematic, right? So the best way to test for SIBO is a breath test. There's something called a lactulose or glucose test, where you drink a solution and they check for 2 different gases. One is hydrogen and one is methane, right? Methane gases typically, not always, but typically will cause constipation. Hydrogen gases typically will cause diarrhea. Some people will come in, have a mixed bag, alternating diarrhea and constipation, right? And they may have both gases that are elevated during the testing. Now, Methane and hydrogen are not the only two types of gases. So if you basically have bloating, your stomach swells to the point where you feel like you're almost pregnant during the end of the day or after meals, you likely have SIBO. And SIBO is the #1 cause for irritable bowel disorders, right? When they say you have IBS, IBS is just a basket term, right? The #1 cause really is SIBO, or small intestinal bowel overgrowth, dysfunction in the GI tract. So in the traditional model, that's what we're looking at. In the nutrition model, we like to do is change the dietary habits, right? Anti-inflammatory type of diet, reduction in carbohydrates, typically all grains, fermented foods sometimes be problematic, alcohol, starchy veggies, legumes. We typically will recommend in the initial phases a FODMAP diet. So FODMAP diet is very specific, and it reduces these food items that cause bloating in a lot of the SIBO patients. So you can go ahead and Google FODMAP diet. Now, we have to be cautious about using a FODMAP diet because it's restrictive. And we do not want to put a patient on a restrictive diet forever. If you put a patient on a restrictive diet, it's very difficult for them to add foods later on because they feel like they have a food reaction. Or they come in, they go, I can eat only 12 types of foods, everything else makes me bloat. So we do not want to be too restrictive for too long a period. But certainly a dietary change is necessary in order for patients to have long-term benefits. SIBO patients in our office can be very easy or very difficult because it can be recurring. Other factors, not just food, can play a role in this, right? People who have concussions, one of the first things that can happen is it can create leaky gut. A brain injury will impact the vagal system of your GI tract and cause dysbiosis and dysfunction and SIBO in a lot of them, right? So you have GI issues as a result of a concussion. Chronic stress can also create SIBO-like symptoms. So people can recover, they go through another stressful time in their life, and SIBO will return. So it can be recurrent. However, with functional medicine or nutrition, it's much more affordable than the $1,500, right? So what we do is we take patients on a FODMAP diet or more of a SIBO-specific diet, right? Eliminating some things. And then we will go after it with herbal remedies. Herbal remedies can be things like oil of oregano. It can be a combination herbal packet, right? But the important thing, or a clinical pearl, is not to use the same herbal product to kill off the overgrowth, but maybe rotate them every 2 to 3 weeks. So it has a chance, so the bacteria doesn't have a chance to adapt. So you rotate these herbal remedies, and then you have to support the GI tract. You can't just go, we're gonna just kill off bacteria. You need to support it, right? You may need nutrition that's good for the gut, right? So GI support is necessary when you have an herbal remedy for SIBO. So those are your clinical pearls, right? You want to be able to change the diet temporarily, not long term, and then kill off the overgrowth, sometimes affecting the ileocecal valve. I will go ahead and Google that and say ileocecal valve massage or release. That could help make the tone of the valve there a little stronger so it doesn't have the reflux back into the small intestine. So this little protocol can help quite a number of patients. Not all of them. Those patients we need to see in office and do more aggressive type therapies. But this is a simple way to see if it will help. All right. My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Have an awesome